Young patients with breast cancer have many different issues. Obviously, they want to be cured of their breast cancer, so they want to optimally treat it. But there are other things that go on in life in a young woman, including trying to start a family. And one of the consequences of using chemotherapy is it may impact on the ability of a woman to get pregnant in the future. So we try to selectively identify women who can avoid chemotherapy if possible. Obviously, we want to use it where it's going to impact on their overall outcome from breast cancer. But there are strategies where we can modify the chemotherapy using regimens that perhaps have less of an effect on fertility issues. And there are also ways that we can protect fertility. We also know that in some women who are going to get many years of anti-hormone therapy, that taking a break from anti-hormone therapy does not impact in a negative way on their breast cancer outcome. So if a woman elects during, say, her 5-year course of anti-hormone therapy, or it could actually be longer, that they're going to get pregnant, we tell them to stop, and once they deliver, we resume the therapy. And recent data has suggested that there's no negative impact with this strategy on the outcome of breast cancer in these patients. So the use of genomic assays has been one of the major advances that we've seen in the treatment of patients with early stage breast cancer who have hormone receptor positive disease. And when I started my career many decades ago now, we knew that at that time we were treating many patients with chemotherapy that probably didn't need it, but we didn't have a particularly good way of defining who those were that really benefited and those who were gaining no benefit. So with the introduction of molecular assays, we're able to look at things other than simply the size of the tumor or the nodal status, but take into account some of the nuances that are under the surface, the molecular makeup of the tumor. And with those tools, we're now able to identify a large group of node-negative patients, as well as patients with lower node-positive tumor burden, where we can avoid chemotherapy and simply treat them with anti-hormone therapy with results that are as good as chemotherapy with far fewer side effects.